Welcome to the 5 C's of Innovation, sponsored by Cisco.
I'm your host, John Gilroy. My guest is Andy Campbell, Government Cloud Solutions Manager at Cisco. In this segment, we'll address collaboration in FedRAMP authorization. We know, Andy, just read the news, you find out what's going on in the federal government. You found out that the Department of Veterans Affairs is delivering more and more care via telemedicine. This saves money because veterans in rural areas don't have to drive long distances to healthcare centers. Does Cisco work in that environment?
Yeah, absolutely, John. The science to creating technology to address problems like what you described with VA and veterans it certainly does focus on lowering cost, ease of access to services, and eliminating redundant administrative capabilities inside of an agency. That's kind of the science to it. The art, though, is how do you get users to actually adopt the tools that the agency provides them with? And I think that's where we've really focused, whether it's patients, whether it's patients' families, administrators, providers of healthcare services. It's making them comfortable with being able to use these systems and making them comfortable and confident that the data that they move to the cloud is actually secure. So a lot of this is science, but a lot of it is the art of delivering a system that provides those capabilities where you can have better access to health care, a better interaction between all the collaborative teams that need to work to solve a patient's problems. But how do you do that in a way where those collaborative team members will actually adopt the technology and use it?
I have a brother-in-law in rural Oklahoma, and if he had to choose between driving 50 miles to go to the VA hospital or doing it online, I'm sure he'd rather do it online, unless it's a pain in the neck. They'd say, throw the hands up in the air. I'd rather just drive.
Right. Well, and online itself is kind of is a term that's not really well defined any longer, right? Online, is that on your Android mobile device as you're driving down the road and you want to receive a call, or the patient is at a video unit at their home, or they're on their laptop with a video camera at home, or maybe in a coffee shop someplace, and the nurse calls to talk to the patient, but the doctor needs to be brought in and maybe a specialist needs to be brought in. Where are they all located at? How are they using tools today that can help deliver the system to the patient, right? And in a way that everyone is comfortable actually adopting those tools and delivering on the promise of technology, right? The science of technology is the promise, but the art to it is making it actually adoptable by all the parties that are part of that team to deliver the services that the agency has gone out and acquired the tools that they anticipate will deliver those services, right? But if end users don't actually adopt them, if the patients, if the providers, if the administrators, if the families don't adopt those tools, well, then what good is it?
Yeah, no good. A tool just sit on the shelf unless they can use it.
Right.
My guest is Andy Campbell, Government Cloud Solutions Manager at Cisco, on
The 5 C's of Innovation, sponsored by Cisco. I'm your host, John Gilroy, and you're listening to federalnewsradio.com.